Hi everybody, Dr. Scott Keller with Synergy Chiropractic Spine and Joint Center. We're going to continue our talk on proper mechanics from the ground up. We've covered the tripod of the foot, we've covered the dorsiflexion and plantar flexion motions of the ankle, and some simple things to kind of start helping yourself and being proactive if you feel or know that you have those problems. In both of those past videos, I believe I mentioned the knees and what we call valgus knees, and that is definitely no bueno. So what a valgus knee load means is basically this inward kind of collapse of the knee, which puts a terrible amount of stress and pressure on specifically some of the inner aspects of the knee. Now, if you look at the statistics or just know just personal experience or other people, 99%, I wouldn't hesitate to say, I mean, I don't know the exact numbers, but of knee arthritis is on the inside. How many medial knee problems do we see other than just arthritis? Well, medial meniscus tears or injuries, the MCL ligament, ACL ligament, which is inside the knee, but a lot of those mechanisms of injury are this direction of the knee. One of the big things that we talk about in our clinic, and that's being talked about all around the country actually, especially in our youth sports, but even just the elite level kind of professional sporting events, is non-contact ACL, MCL, medial meniscus tears. If any of you know anything about that, it's called the terrible triad. So, you know, if you're on a football field or a basketball court or whatever you do and you get hit this direction and you blow out your ACL, MCL, medial meniscus, or any of those three, you know, that's something that you can't do a whole lot about a lot of times. But the staggering statistics are, especially in young female athletes, 70, maybe 80% of ACL tears or knee injuries on that inner aspect are non-contact injuries. Well, why is that? Well, one of the reasons is because there's a few reasons, but one of the issues can be the foot and the ankle, which we've already talked about. Instability in the foot and the ankle lead to this over kind of valgosity in the knee when they land, when they jump to hit a volleyball and they land, when they jump to get a rebound and they land on their feet. They don't have proper control in those structures and their knee goes in, and that repetitive weakening over time, and then all of a sudden just one time it just goes without any contact. Another really common, I can't stress that enough, problem or issue that we see is improper stability and control in the hip. Okay, when you don't have proper control, strength, a lot of different factors and variables in the hip, specifically in the glute area back here, these muscles help maintain this outward position of our knees. If you just stand, once again, forget about your feet like we've talked about in the past, but if you just stand and let your legs relax, and then you squeeze your glutes together, feel what that does to your knees. It should feel like the knees kind of bounce outwards a little bit, which is a more stable position. So when a young girl or a young man jumps up for a rebound, comes down, and they don't have good control or strength in those glutes, that one might let that knee go in as they try to absorb that impact, and boom, there goes an ACL or an MCL or a meniscus. So the exercises today are not only important for all of us, but if you have kids or know people who have kids who you just watch them and something just doesn't look right in their knees, this is something that needs to be addressed. What we're going to do is just a couple simple exercises. Once again, a lot of these things are super complex and there might be multiple variables, but at least you have somewhere to start. You can grab a band such as this, a circular band, or if you don't have one of these and you just have regular like TheraBands, you can tie it in a circle or a loop, and that's actually kind of nice because you can tie it tighter for a little bit more resistance, and you can loosen it up if you need a little less resistance. What we're going to do here is put the band right around the top of the knees, okay? So it's not over my kneecap, it's right around the top of my knees. Preferably, again, I'd like to do these kind of drills barefoot so I can continue to work on the tripod of the foot and kind of that proprioceptive input in my foot. But if you need to do them at the gym in a pair of shoes, that's fine too. We're really focusing today on that glute activation. So what I want you to do is get in a good squat stance. Once again, feet underneath the hips, Fairly straightforward in the toes. You can have a little bit of flare out depending on how your hips function and the mobility in your hips. Bringing up another point really quick is not everybody can squat alike. So if you've ever had anybody tell you you have to squat with a narrow stance, feet straight forward, or you have to squat like this, not necessarily true. Everybody's hip structure is different, everybody's needs are different, so you might have to vary some of these things just a little bit. But the important thing about a squat is what I talked about, I think, in the tripod of the foot video, is not squatting with the knees bending first, and definitely not squatting with a flattened spine angle or bending forward like this, putting a lot of stress on your lower back. We want to do and create a hip hinging motion, which basically looks like you're pushing your butt backwards. Okay, somebody hits you in the front of the hips and your hips give out and you go backwards like this. Okay, so that's a proper squat motion. All we're going to do with the band is just push out into the band a little bit, once again kind of activating or squeezing those glute muscles there. Okay, and all we're going to do here today is do little quarter to half squats. Okay, starting with that. So just once again, just like the tripod of the foot video, you're going to squat just like that from a side view, push out with the band, sit back, and squat. Okay. The next drill is a side step type of a technique. So you're going to get a little bit of a squat here, kind of just that quarter-ish squat, and you're going to take a step to the side and follow with this leg. Step to the side, activating this glute, follow with this leg. And then you can do back the other direction, just like that, okay? If you're doing that properly, you should feel a little bit of a burn happening in the glute muscles back here. If you feel it other places, that's okay, but if you primarily feel it somewhere else and not in your glutes, you're probably not getting proper glute activation, so it's something to work on, okay? So once again, super simple drills. There's a lot of other things you can do, but this will give you a good start. If you have any questions, don't hesitate to give us a call or an email, 402-328-2660, and Scott@synergylincoln.com is my email. Love to answer your questions. Thanks. Good luck with this one.